everyone. We have had a bit of a whirlwind of a morning. Our vaccine arrived. It arrived a little sooner than we expected. So we did a unexpected test run of our first vial to make sure all of our systems are working. And so we are really, really thrilled this morning to introduce you to our first 5 vaccinated healthcare workers, members of our healthcare team. So we're just going to kick it right off. I'm going to open it up to our 2 of our pharmacy experts here who can just tell you a little bit about the vaccine's arrival this morning. So Kavish and Russell, I don't know who of you wants to go first. I'm just going to leave it to you.
I'll defer to Kavish.
Okay, thanks, Russell. Yeah, we received notice over the weekend that our order had been placed by the state. So we were anxiously waiting for the tracking number. We got the tracking number yesterday. I've been tracking it overnight. This morning, just before 7 o'clock, we got notice that it had left the airport in Salt Lake, or I'm sorry, the UPS area in Salt Lake, and on its way to the hospital. So we notified our doc team. Our doc was well aware and prepared for the vaccine coming in. The vaccine came in just a little after 7 o'clock. And we then, when the vaccine arrived, we notified the CDC. The CDC had an individual allocated to the university to witness the vaccine coming in, more specifically watching us taking it out of the crate and container and putting it into the -70 freezer. That took place around 8 o'clock or 8:15 this morning. And then after that, based off the CDC guidance, we had about a 2-hour time frame, actually exactly a 2-hour time frame where the product had to sit in the freezer before we can take anything out to start administering it to patients. So a bit of a whirlwind morning and try to get the vaccine ready to go for administration.
Russell, is there anything you'd like to add to that? Russell Finley from our pharmacy team.
Oh, thank you, Kathy. No, it was a collaborative effort. We had a number of folks help prepare the medication from our team. We had our pharmacy resident administer it to the first 5 patients, the staff members here at the University of Utah Health. Yeah, just a very exciting day, very memorable.
Okay, well, I am very, very happy to introduce all of you to Christy Mulder. She is a nurse in our medical intensive care unit, and she was our the first member of our healthcare team to be vaccinated. So Christy, do you have any thoughts you want to share with everyone this morning?
It's an overwhelming day today. Lots of emotions, excitement, joy. Just, I'm still trying to process it all.
Tell us a little bit about your thoughts when you were first getting vaccinated and your thoughts going up in, getting vaccinated today. Were you excited? Were you nervous?
Yeah, I mean, I'm definitely excited. I'm excited for this next step that we are taking to ending this painful pandemic. Excited that we can be looking forward, that there's a light at the end of the tunnel. So, yeah.
Thank you. I'm going to ask Diana Navarrete to talk next. Tell us a little bit about your experience today getting the vaccine.
Yeah, so I was super excited to get the vaccine. Like Christy said, I work with Christy in the medical ICU, and it's just been like a rough couple of months. So to be able to have a vaccine come out and to be able to be provided with it is just really great. It's like a light at the end of a tunnel.
Ellen, do you want to go next and tell us a little bit about how you're feeling today?
Yes.
Ellen, you're on mute. We need you to unmute.
Okay. Hello?
You're good.
Hello?
Yep, you're good. How are you feeling today, Ellen?
I am good. I am good about it. and it was nice. I was so excited to get it first, and like what those two are saying, it's getting out of it, and it's going to be excited for the next feature and everything. So I'm so excited about it, and for everybody that we're going to continue what you guys gave us. We're going to continue. We going to go on with our patient safety with everything, and we're going to continue working here. And like they say, we're going to do this all together. I hope everybody gets their shot and everything. It's for good. Thank you.
Thank you, Ellen. And Brad, I'm going to come to you next. Ellen, if you want to go on mute, and Brad, I'm going to come to you next. So tell us a little bit, Brad, about your thoughts going into today and getting the vaccine.
I always knew that I was going to be getting the vaccine. This is just sooner rather than later. I had made my mind up a while ago that I was going to get the vaccine. So they called me up and asked me if I wanted to get it, be one of the first ones to get it. And so I thought I'd lead by example and get it first. So hopefully people follow in my footsteps.
Let's hope they do. Thanks, Brad. And Dr. Hartzell, we're going to finish up with you. Of our 5 vaccinated today, tell us a little bit about your thoughts today, being one of the first and in our system to receive the vaccine.
First, I was thankful to be included in the first 5 and people to get the vaccine. But I just kept remembering what a remarkable day this is. I think some people have referred to it as a moonshot for infectious disease, but to see a vaccine produced this fast and in our arms is just amazing. Less than a year after isolating the SARS-CoV-2 virus, we are now getting immunized. So I think what to me this seems like, and I know it does to the providers in the emergency department, is probably one of the best Christmas presents we've ever received.
Great. Thank you, Dr. Hartzell. So the names are in the media advisory we sent. We can go through and we'll put the names in the chat as well. So we're being asked, is Christy Mulder the first in the state to receive the vaccine, or the first healthcare worker? She's the first in our system. We don't know at this point if she's the very first in the state, but she's certainly the first for University of Utah Health. We believe she might be the first in the state, but we're not sure. We do recognize that other hospitals have already received the vaccine. Let's open it up in the chat to media for your questions for our 5 healthcare workers here who were vaccinated today. And we do have one of the vaccinated here does speak Spanish, so if we have questions from our Spanish language media colleagues, we can refer that to Diana. Dr. Mayer, I'm going to ask you to just make a quick comment while we're waiting for media to ask their questions this morning. Can you tell us a little bit about all the work that went into this plan this morning?
Yeah, thanks. So I've been leading the overall committee to get the COVID vaccine program up and going at the University of Utah Health, but there's really 5 subcommittees, and the major part of the workload, I would say, is to the pharmacy groups. So Dr. Chowdhury and Dr. Finlay have been really leading the charge in terms of pharmacy. I mean, it was just a huge endeavor in terms of figuring out how to get the vaccine, where we were going to store it, having all our backup systems, getting, a tremendous number of people volunteering to man all of the pharmacy, the vaccine clinic stations. There's plans in place to really go up to the units this week, and then to really start the actual vaccine clinic. And then also, I don't know if Brooke Gardner is on the call, but I would say our work wellness group, really in terms of identifying all of our healthcare personnel throughout the system, and in terms of all the sort of the communication work that's been done with Julie Kiefer, who's on the call, has been leading that team up. And then also, what maybe people don't recognize is the informatics and the documentation and how we have to track and how we're going to be reporting that to the state. So just really an overall, and then working with, Dr. Pavia as one of the other infectious disease experts who's really been key to this. So just, a large number of people and multiple teams working together to get this up and going.
Thank you, Dr. Mayer. Either Dr. Chowdhury or Dr. Finley, a question for you. Can you describe how it was a whirlwind situation to get the vaccine? Were you surprised you'd be getting it this soon?
I guess I can take that. Thanks, Kathy. In regard to this soon, I guess when we were looking at the UPS tracker, it was stated 10:30 this morning, but based off our experience, we expected to come in a little bit earlier. In regards to the timelines, as the announcement came out from the state last week that we should be getting vaccine either on Monday, Tuesday, or Wednesday, we were kind of guessing we'd get it either Monday or Tuesday. And so we weren't necessarily surprised in getting it this early. I would say that maybe what was surprised us was at how small the package actually was. I know our PR team got some photos of it. It wasn't as overwhelming as I thought it was going to be in regards to the package coming in. It was a small box that had 3 trays in it, all packaged in dry ice and stuff like that. But it was a whirlwind in regards to the second we got it in. We've had a number of plans in place for when it was coming in based off of the timing, because we, as Dr. Mayer mentioned, we have a number of clinics we want to get set up for our staff. We want to try to be as efficient as possible in getting, we have 17,000 employees plus 2,000 students we need to vaccinate in a short amount of time. So for us, it's been planning for when it's coming in to go ahead and execute the plan and strategy and getting our staff and students vaccinated as quickly as possible. So to me, that's been the whirlwind process, because we just didn't know what day it was coming in, and depending on the day, depending on what location we'd actually execute the clinic out of.
And while we're on you, can you briefly describe, how this will roll out? How many people are vaccinated today, tomorrow? Can you give everyone here a brief description of what we're going to be doing over the next few days?
Yeah, thank you, Kathy. So for today, we're doing a slow rollout today. So we took care of the 5 patients this morning, and then we're going to go to our medical intensive care unit later on this afternoon and continue to do staff up there. So we'll probably get between 25 and 30 staff total today. Again, the reason why we're going such low numbers today is that we're getting used to the vials, getting used to the vaccine itself. It is, from the compounding standpoint, a bit different than stuff we've been accustomed to. And then starting tomorrow, we'll run another clinic out of the MICU area. And we'll hopefully get a couple hundred people tomorrow that either from the MICU and the other acute care units that have COVID positive staff or that take care of COVID positive patients. And then starting Thursday and Friday, we're running a larger clinic out of the back of the ED in one of our locations out there, just to take on a larger number of staff. But then next week, we'll actually go into our bigger clinic location at the main hospital that can accommodate 15 vaccinators at a time, as well as hopefully turn over patients every 10 to 15 minutes. To pull off all of these respective clinics, there's been a number of folks involved. I do want to give a shout out to our colleagues in facilities and engineering. They've done a Herculean effort to get a number of spaces ready to go. As Dr. Mayer mentioned, we had a number of folks within IT or informatics getting our feed set up so we can report back to the state in a quick and efficient manner. In addition to our support services, so environmental services, parking, valet, et cetera. We've had a number of folks involved just so we can have a streamlined process for getting our staff from offsite locations up here to administer or to receive the vaccine, as well as our communication department and a number of others that I'm probably missing. But it's been a large number of folks involved in trying to get these first 5 patients vaccinated, but also as we have to get these 19,000 people vaccinated twice, a lot of folks involved in just planning all that.
Okay, and Christy, I have a question for you. For the frontline healthcare workers who got the vaccine today, do any of you have any personal stories of anything that you've seen treating patients in the last month that solidified your decision to get vaccinated? And then I have another one for you right after that.
Yeah, I think the first thing that comes to my head is how painful it is to see patients suffer for so long. There's always been a lot of suffering in the MICU, a lot of death, but there's something different about COVID-19 in that it feels so much longer. All these patients are with us for so much longer. And so that weight feels heavier and heavier over time. So to see a vaccine, to get a vaccine, it really is overwhelming because it's the beginning of an end, and that's really hopeful.
Thanks, Christy. And I think this can go to either Christy, Brad, or Diana. I think, and we'll start with you, Christy. I'm sure the pandemic's been a difficult time for MICU nurses. I'm sure they've seen some really tough things over the past few months. So having gone through all of that and dealing with COVID-19 patients, how does it feel to be a part of the beginning of the end? We'll go through and get all of you, all 5 of you answering that question. How does it feel to be a part of the beginning of the end?
It feels like a weight lifted off. As healthcare workers, on one hand, it's an honor to be able to care for our community during this time, but on the other hand, we're tired and we're drained. We're emotionally and physically drained. So to have a day like today, it's really encouraging, and it does feel like a weight lifted off. And it's just so special to be a part of.
Diana, how are you feeling?
Good, really good. The past couple of weeks have been pretty rough, so to be able to be part of the few first to get the vaccine is just really great. Like, it's been really tough, so this is just a good start to hopefully we see less cases and people are able to get better, and hopefully people are taking the vaccine and take this more seriously. And yeah.
Dr. Hartzell, how are you feeling about this being the beginning of the end?
Again, this is a historic day. I think it's hearing the stories that Christy has related. They're obviously profound. I think the most important thing, and probably the reason that all of us stepped up to be the first vaccinated, is to be an example for not only our fellow workers and fellow healthcare providers, but also our patients and the public in general. And hopefully this will encourage them to, when they get a chance to step up, get in line and get immunized. I don't think we could ask that of them if we hadn't stepped up and been the first to do it. And I'm hoping that does happen, because that's how we get to the end of this pandemic.
Thank you. Ellen, you want to go next, and then we'll go to Brad.
The beginning, we were kind of a little bit, don't know what's going to happen. And then when we start doing the discharges, patient going home, and that means like to the end, that means that people are getting better, but it was hard for all of us, the beginning. And right now we're right in the middle. We are not get to the tunnel yet. So by we're getting there, but when we see a lot of discharge going on and cleaning the rooms, that means that our patients and our front runners are getting a little bit stress off them, that they're going home and all that.
Okay, thanks, Ellen. Brad, do you want to tell us your thoughts about this day being the beginning of the end?
Yeah, like I stated before, I was always going to get this vaccine regardless of what day it was. But I just think it's important for the people in the community to realize that this isn't over. This is still going to be going on every day. The more people that get vaccinated, the more that will help with all this.
Okay, thanks. And we have a question, just to be clear, were the vaccinations given at the hospital? Yes, they were. And they will continue to be given here at various locations on site at the hospital. I'm going to throw it again to Drs. Chowdhury or Finley. Talk a little bit about how this works from when we receive the vaccine to getting it in the freezer, how long it has to be. Give us an idea of the timeline of this process we went through this morning, why it was a little hectic and very time sensitive. Do you want to start with that one, Dr. Finley? Yeah.
Yeah, I can field that question. So we have very prescriptive timelines with this vaccine regarding how much time it takes to take it from the shipping container into the ultra low temperature environment. For a full tray of 195 vials, we have 5 minutes. And if it's has fewer than 195 vials, then we only have 3 minutes. And so we have to be mindful of, again, the very expeditious transfer between the shipping containers into the ultra low temperature freezer. And then we have to be mindful of when it's exposed to room air, we have to keep it for 2 hours stabilized in that ultra low temperature environment before we can access it again. And then after that, we need to worry about thaw times. So we take out 1 vial or however many vials as we think about future vaccine clinics, and we have to thaw them. We have 30 minutes to do it at room temperature, or up to 3 hours in a refrigerated environment, meaning 2 to 8 degrees Celsius. And then after that, we reconstitute it and prepare it and draw it up into syringes for administration. And then there are only 6 hours after we do that, we have to use it. Otherwise, it's no longer stable and we have to discard it. So we have, again, very defined time constraints. And when we think about deploying this across different vaccine clinics, and as we think about larger groups of people, our plans need to be very mindful of how many vials we take out to thaw, how many vials we draw up in a syringe, how many people can we vaccinate in a certain given period of time. And so all of these factors come into play when we when we manage the inventory and when we plan these clinics, because it has to be correct.
Thank you. Dr. Pavia, I'm going to throw a question your way. Can you talk a little bit, you've been on our planning committee, can you talk a little bit about who is getting vaccinated and why we've chosen the teams we have to be vaccinated first? You're on mute, Dr. Pavia. Sorry.
I'll fix that. Thanks. Thanks for the question, Kathy. So, the goal is to vaccinate our entire healthcare team. And our healthcare team isn't just doctors and nurses. It's people who work in environmental services. It's medical assistants. It's people in security. And those that we want to get vaccinated first while the logistics are challenging, while we don't have enough vaccine for everyone, are those that are working in the areas where they have daily high-level exposure to patients with COVID, but also we really depend on them. They're exhausted, they're short-staffed, they're working extra shifts. We can't afford to have them get sick. And so that's why we're focusing on the emergency department, the MICU, and the dedicated COVID units. So these 5 patients, or these 5, not patients, these 5 members of our team are just representative of that. As Dr. Chowdhury said, ultimately there are 19,000 people who we need to get vaccinated as soon as possible. And once we can get up to speed and do 500 people a day, we can really move through that pretty quickly. But this is just the beginning. And, to paraphrase Winston Churchill, it's not really the beginning of the end, because we've got a lot more work to do. This is the end of the beginning. And not only we have a ton of work to do to vaccinate everyone here, but think about every other healthcare provider throughout the state. It's not just at the big hospitals, but eventually it has to be people in small clinics, in community clinics, in remote areas of the state. So this is a huge, huge project that we're just beginning as a state.
Thanks for that. So a question here, it's been proven that the vaccine is safe and effective, but what would the workers who were vaccinated today say to anyone out there who might still be skeptical about taking the vaccine? Dr. Hartzell, I'm going to give this one to you. And then Diana, I'm going to ask you to answer this question in Spanish, if you wouldn't mind. Dr. Hartzell.
I think what I would say is a lot of times we do look at risk-benefit ratios, and we sort of know what the risk of getting COVID is and what a profound effect it's had on our country. We're talking about 300,000 deaths in this country. In a country that's 4% of the world's population has 20% of the deaths. I think this is a problem that we have to take maybe some minor risk for. As Andy Padilla has said, his review of the vaccines, the efficacy of this vaccine is amazing by the phase 3 trial data. And in fact, at 95, 97%, I think that actually takes away a lot of the risk that you would worry about in getting this vaccine compared to getting the disease. So I know that there are people out there that are hesitant to get the vaccines. I know we have populations that have reasons to be hesitant, but I can only say that we also know that unless we get about 70% of our population of the United States vaccinated, we're not going to get to that point of immunity where we can truly sort of end this pandemic.
Thank you. And Diana, would you like to answer that question in Spanish? What would you say to people out there who are hesitant to get vaccinated?
Yeah. So, con mi experiencia en poder trabajar con pacientes de COVID, la verdad diría que es mejor obtener la vacuna que tener la enfermedad. La mayoría de nuestros pacientes son de comunidades latinas, entonces sé que en la cultura uno se junta con toda su familia y entonces es más riesgo de tener infección de COVID. Y con la vacuna podría ayudar más. Creo que es importante de obtener información de cosas médicos o de artículos de científicos, o tratar de preguntar a alguien, un doctor o alguien que haya trabajado con alguien que ha tenido experiencia con esos de COVID, porque sé que hay mucha gente que dice, ay, no quiero ganar la vacuna o esto y esto, pero la verdad con mi experiencia creo que es importante de poder enterarse en buena información y obtener la vacuna.
Thank you, Diana. And Dr. Pavey, I'm going to throw it back to you quickly. Since you are involved on many levels in this vaccine, can you give us your thoughts on what would you say to folks who might be a little skeptical about the vaccine?
Well, I think it's always understandable to be worried about something new. And there were a lot of thoughts about political interference, and, calling it Operation Warp Speed suggested that things were moving really too fast. But none of that is really true. The processes to do this safely and scientifically turned out to be really exactly what we needed. The data has been shared incredibly well by FDA. Anybody who wants to can look at the original studies. So we need to explain to people and address the worries that they have where they are. But all of us who've been watching COVID ravage the community and seeing patients die are really incredibly grateful that the vaccine is here and that we have a chance to get it, and can't wait to get it. There's a meme going around that says that Some people are hesitant to get the vaccine, but all of the healthcare workers would take it if it was a needle in the eye. That's a little extreme, but it gives you an idea of how, I'm sorry, a little choked up, how excited we are that we have this tool here.
Thank you. I want to thank everyone here today. We're very excited today that this was able to take place, and this is the beginning of the end. We were able to vaccinate members of our healthcare team. We'll continue to do that as we receive the vaccine. For all of our, I'm not seeing any other questions in the chat, so we're going to close it here. We will have photos available and video available of the vaccine arriving, of it going into the storage freezers, and of the vaccination. Some of you may have seen that we had a Facebook Live feed, spur of the moment decision that we had here, but we also have photos and video that we're happy to make available to all of you. Any other questions before we close here? And you can follow up with us later. And we're being asked here if, Diana, if you were the first Latina to be vaccinated. I think so. in our system, I think so today. Of the first 5 in our system, Diana is the first Latina. So thank you, everyone. Looks like we might, looks like maybe let's stay on the line here with Diana here for a minute. Do we have questions? Marco, it looks, do you want to do more, do you want to interview Diana a little bit more? Let us know and we'll stay on here. Otherwise we can let everyone else go. Thank you all so much. And if you have any follow-up questions, feel free to reach out to us. Diana, I'm going to have you stay with us here for a minute in case, okay, it looks like we have other people who want to interview you. Marco, do you want to just turn your volume on and you can ask Diana?
Diana, hola, soy Marco. ¿Cómo te sientes de ser la primera latina que tiene la vacuna acá en Utah?
Hola Marco, me siento bien, muy bien por poder ser la primer latina que puede obtener la vacuna de COVID.
¿Qué mensaje le puedes mandar a nuestra comunidad siendo latina y en español para que sigan este ejemplo tuyo?
¿Puedes repetir la pregunta? Perdón, no lo escuché tan bien.
¿Qué mensaje le puedes mandar a nuestra comunidad siendo tú la primera latina que sigan cuidándose hasta que les llegue a cada uno la vacuna?
Yo les diría a la comunidad que se cuiden mucho. Sé que en nuestra cultura es una cosa normal que nos juntamos todos porque la familia es súper importante, entonces, pero tratar de tomar sus precauciones cuando sale a la tienda, usar la máscara y usarla sobre su nariz, porque veo que a veces hay gente que no la usa así. Tratar de limitar el número de gente que se junta. También, si tiene sus cuestiones o preguntas de la vacuna, tratar de encontrar información o preguntar a alguien que sabe información sobre la vacuna. Creo que muchas de las personas que no quieren tomar la vacuna no tienen la información correcta o están misinformados. Entonces, la mayoría de nuestros pacientes son latinos, entonces he visto y tengo la bendición de poder hablar español y poder cuidar a nuestros pacientes, pero no quiero ver más pacientes latinos o no quiero ver más pacientes de COVID en la hospital. Es bien difícil ya como está. Muchos de nuestros pacientes cuando son de comunidad latina están acostumbrados de tener familia o alguien con ellos y de verlos solos. Puedo imaginar que es bien difícil. Para mí ha sido bien difícil porque pienso, esta persona puede ser mi papá porque mi papá tampoco habla inglés. Entonces, Ya, eso es lo que le diría.
¿Tuviste miedo?
Diana,
Yo tuve miedo
Ah,
como de
la vacuna,
COVID o de la vacuna o...
de la vacuna.
No tuve miedo. Creo que las personas que los hicieron, ellos estudian por muchos años y tenemos la información y tenemos nuestro equipo que nos dio toda la información de qué efectivo y la seguridad y todo eso. Entonces me sentí bien agarrando la vacuna.
Diana, soy Michel Ceballos de Telemundo. Tengo una pregunta para ti, con respecto, ¿te dolió la vacuna y que me expliques cómo fue el proceso para hacerla, qué les dijeron que debían hacer antes de recibir la vacuna y posteriormente cuando reciben la vacuna? Que me describas brevemente un poco el proceso de cómo fue para obtenerla.
Yeah. Bueno, como apenas empezaron a dar la vacuna para los que trabajan en el hospital, perdón, ¿puede repetir su pregunta?
Sí, seguro. Primero, si te dolió la vacuna y,
No,
y lo, se- y lo segundo sería que me describas brevemente el proceso. Ustedes tuvieron que les enviaron un correo, ¿cómo fue básicamente para darte la hora y y el día de hoy que ibas a recibir la vacuna? ¿Cómo fue ese proceso?
yeah, no me dolió nada, me sorprendió, la verdad, como en otras vacunas a veces te duele un poco, pero esta no me dolió nada. El proceso fue que nos mandaron como un email y nos preguntaron cuándo quieres o cuándo quisieras obtener el vacuna porque se nos están ofreciendo a todos los que trabajan con pacientes de COVID. Entonces llené eso y deciden, ¿quieres ser el primero, segundo ronda o el tercer? Y yo decidí el primero porque yo quería obtener la vacuna el primero chance que podía. Y después de ahí me informaron, vas a obtener el vacuna este día. Entonces llegué y pues a ver cómo me siento mañana, pero ya.
Any other questions for Diana?
Sí, cuéntanos un poco acerca de tu background. ¿Tu familia de dónde es?
Yeah. Mi familia, bueno, mi papá es de México y mi mamá es de Wyoming. Mi papá es de San Luis, Sonora. Ya tengo una hermana y un hermano.
Muchísimas.
Diana, por mi parte, una última pregunta que te quería hacer. Ya después que ya recibes la vacuna el día de hoy, ¿tienes mañana, les dieron una programación para tomarse el día de mañana, de acuerdo a los efectos que tenga la vacuna? ¿Qué les dijeron posteriormente ahora cuáles son los pasos a seguir que les recomendaron al aplicarle esta vacuna?
Yeah. Entonces sí no trabajo mañana ni el día siguiente. Nos recomendaron que no trabajáramos 2 días después. Tal vez sí tienes el efectos, pero sí tengo los días libres. Por lo menos 2 días por acaso sí te da efectos, pero
Okay. Any other questions for Diana? I think we're going to close it out here.
¿alguna otra pregunta?
There's a comment here, Diana, thanking you for all you've been doing. So thank you for that for sure. We're so glad to see you vaccinated today. Thank you, everyone, and please feel free to follow up with us if you have any questions. We'll be sending out B-roll and photos as soon as possible. Thank you all.